Health advocates under the aegis of coalition of civil society groups working in the health sector are asking for increment in the proposed 2023 budget, describing the 5.7% as grossly inadequate in view of Nigeria's population of over 200 million. The group also demands inclusion of family planning commodities funding, describing the failure of government to fund family planning in 2022 and in the proposed 2023 budget as reckless and unforgivable.
Over the last years, appropriation to the health sector in the national budget has consistently fallen short of the Abuja Declaration of the African Union that recommended 15% allocation of national budgets to the health sector. Also, healthcare investment per person has been below the recommended 6,000 naira per person.
They add that despite the nation's growing population, which has resulted in increased maternal and infant deaths, insecurity and poverty, Nigeria is yet to accord the desired funding for a sustainable population. Led by Honorable Usman Mohammed, the advocates, who include the Partnership for Advocacy in Child and Family Health at Scale, Nigeria Health Watch, USAID, Vaccine Alliance, and the Legislative Advocacy Initiatives for Sustainable Development and the Health Advocates for Health, therefore called on the National Assembly to review the proposed health budget to ensure adequate funding in the final approval.
The Technical Strategic Group, TSG, of the Legislative Initiative for Sustainable Development, in collaboration with civil society groups and coalitions, request commitments and investment interventions to address the issues which are centered on the following. 1. Fulfill Nigeria's commitment to pay $4 million for family planning commodities, procurement, and consumables. Increase the family planning budget line on programs. Improve family planning services through contraceptive use, interventions, and counterpart funding. The proposed 2023 budget line is insufficient to deliver on Nigeria's health agenda. Increase the current health budget, which is proposed at 5.75% of the total national budget. Nigeria's global commitment, that is the Abuja Declaration of 2021, is 15%.
The stakeholders say the proposed 1.179 trillion for healthcare in the 2023 national budget is not sufficient for Nigeria to achieve universal health coverage by 2030, meet the health-related sustainable development goals (SDGs), and tackle emerging epidemics and pandemics. The advocates are also asking the government to fulfill its commitment to provide 1% of Nigeria's budget to family planning, improve family planning services through contraceptive use, interventions, and counterpart funding. The group also seeks more funding for polio eradication and other child killer diseases. Benny Ark, Arise News.